My story began with a death sentence.
My beginning is before AIDS.
She talked about this new disease. It was going to change the face of medicine in South Africa.
Very few of us had any understanding of the epidemic.
Really, I had absolute, complete faith in the fact that, science would prevail.
When the epidemic first came, I thought it really didn't concern us. It was a problem of white gay males in California, and that was a dreadful mistake because, as you've seen, from the 80s, we've become the worst affected country in the entire world.
We had HIV. We didn't have the drugs at that stage.
The drugs haven't arrived.
Who could afford to be on the antiretrovirals? And you were talking about $10,000 a year.
Yeah.
We had this real view that there was new hope. I think we were all a bit patient. We were saying, Mbeki comes to power and we need to allow him a bit of time to bed down. Same was true for Mantu.
What I kept hearing was, you wanted a policy on treatment, you've got it.
Some of the memories I have is of a lot of people dying, a lot of friends dying, personal confrontations that I had which were unpleasant with the former Minister of Health.
It was already known that the infection in children can be prevented, and yet they were still dragging off feet.
There was a bit of conflation of the issues. We then got into a bit of a debate which polarized us as a country.
As we grew, AIDS denialism hardened. As it hardened, we had to fight it harder. As we fought it harder, Thabo Mbeki, being a proud and arrogant man, hardened his position further, and unfortunately we got into a kind of, I think, vicious spiral.
There were very few people who supported us fighting Thabo Mbeki. And within the government itself, if there is a handful I can think of who stood up, it's a lot.
From an international perspective, we were embarrassed.
Bearing in mind that it's always been the case that an effective response will have to be a national response.
What moved and inspired and motivated you in those days was the personal interactions with people.
I think it's right to capture this history.
I started getting involved around 1982, understanding something about HIV when I was at Johns Hopkins University in Baltimore. And at that particular time, there was still an effort to try to understand what is this disease. It seems to be affecting, gay men. And what is it? What in gay men put them at risk of HIV? So from a public health point of view, from the courses that we're taking at the time at Johns Hopkins University, we started asking this question, and it became a very serious discussion among students, public health students of the time. And then I moved on. Obviously, I worked for the District of Columbia government. And in that particular position, in research and statistics as a senior health statistician, I then had to deal with the question of death certificates and trying to begin to count the number of people in the District of Columbia who might be living with HIV/AIDS and who died of HIV. So we began seeing certain symptoms, and we say these symptoms seem like they are HIV/AIDS, and would send them back, would send our nosologists back to the hospital to try to identify a bit more as to is this AIDS, and indeed it turned out most of those were AIDS-related deaths, and we're able to put up statistics for the District of Columbia. And I started joining the District of Columbia in 1986. At the time, it was a lot of discrimination because people were simply saying, oh, we shouldn't worry about this disease. This is the disease for gay men. It's not the disease for heterosexuals. or were safe if at all you are a heterosexual. That's what people were saying. And we kept saying, well, you know, public health teaches us that any disease that starts with any group is more likely going to spread to other groups. It's only a matter of time, indeed, that everyone will be affected. So it has to be nipped in the bud, you know, at the time. But there was a lot of discrimination against people living with HIV/AIDS in the U.S., yeah. What I was working on, it was really, at the time, it was just looking at the death records and being able to record that information. In other words, be able to put some statistics, you know, for the District of Columbia to be able to monitor the epidemic. So when I came back to South Africa in '91, from exile, I was in exile in the U.S. at the time. When I arrived, one of my first presentations that I made was, let us look at the question of HIV, you know, for South Africa and make sure this epidemic doesn't spread as quickly as, you know, it has in other places. And I was very worried about that from a public health point of view. And of course, I joined the Department of Health and worked with Minister Nkosazana Zuma, and we started working with her. And she took a lot of leadership politically in terms of pushing the HIV/AIDS agenda in the country. I was not at the NACOSA meeting because of the fact that I was in the process of doing some other issues that was on the transition, so I didn't go to that meeting. But Minister Zuma went in and President Mandela went in. Resulting from some of that work that was done for NACOSA, it actually informed the Department of Health, where I served, you know, later on as a Director General of Health, the first Director General under the post-apartheid South Africa. I recall at that particular time when we raised the concerns that if we don't tackle the epidemic, this epidemic is going to overshadow a whole lot of things that we're doing. So what we did, we created at that particular time, it was a presidential program on HIV. There was a presidential program. It was one of the big priorities of the Mandela administration. And we hired Dr. Qurecia Karim as the first director of HIV/AIDS in the post-apartheid, you know, government. And she set up the program, built a lot on what her knowledge was from her research that she has done, but also she pulled some of that information that came in from NACOSA. It was not an easy time because everyone was trying to understand the new way of working within government. And it was difficult at that time. There were challenges even with the activists outside. They sort of felt that the Department of Health was not doing enough on HIV/AIDS. And they could have been correct because of the fact that this was a monumental, you know, challenge to restructure the healthcare system, get the resources, build the clinics where services are going to be provided, ensure more people are trained to be able to provide, you know, healthcare. And yeah, I mean, they probably had legitimate reasons, you know, for why the move wasn't as fast as it should have been. And of course, you know, expectation is that it should have been fast. The discussion was, what is it that can be done to reduce this new infection? Is the strategy of IEC, you know, information, education and communication, is it working? What do we need to do? What, you know, science is available there to address this epidemic? How do we change people's behaviors? It was difficult because we didn't have those interventions that you know that this is actually going to work. So it was a lot of trial and error, reading what, you know, the international literature say about IEC, and fuzzy as it was to say implement it. One of the strategies we used was, why don't we bring in people who live with HIV/AIDS and work in the Department of Health? And I think we used to call them the faces of HIV. so they could be out there visibly, be seen that HIV is real. It exists in the society. Here are people who are infected with the disease. And I must say, even some of the actions that were taken by the Department of Health, like, for example, the play, the Sarafina play, if you look at it very closely, it was an attempt to say, can you do something quickly that can arrest this epidemic? It was just that determination to say, do something that can be able to reduce the new infections. So, I'm just simply saying that it was not easy. Yeah, one of the most difficult periods of working in government was trying to balance the healthcare system service provision with a disease that was threatening to engulf the resources, to take away all the resources that we had. Yes. So instead of getting the message about HIV and what people needed to do, the media concentrated a lot more on what went wrong with the play. So it became the politics of HIV as opposed the education of people about how they can prevent themselves from becoming infected. I think the media could have done a better job, throughout that period, balancing the issues of accountability, which are important. I'm not saying that they were not important. I think they're very important because public purse, resources must be managed properly. But you should also try to understand what is it that is being done, to try to get the message out to people. That was the longest controversy I can recall. I think it lasted more than 5 years, even past the event itself. It just kept coming back and coming back. I was working in the Department of Health, and I was shocked, actually, when I found out that there was this virodin issue going on in the department. And I asked questions. I said, where is the evidence that this thing works? And our view was that, from the department, was that this issue has to be taken to the Medicines Control Council so they can be able to give guidance in terms of whether this particular product can be used on, people living with the disease. Yeah, it was in the department. Someone called me from outside and said, do you know about this thing? I then said, well, let me find out. I don't know anything about it. When you run a bureaucracy, you must remember that a lot of things can happen around you without you being aware of it, because it's a huge bureaucracy. I mean, we had 1,200, people in the department, and we had politicians also. So as a director general, you are always sandwiched between, politicians and the department. And some things you'll be aware of and some things may not be aware of. But once we were aware of it, we try to ask a lot of questions, about it. Yeah, for me, I'm a scientist in addition to being a public health person. So I had a good sense of what evidence is required in order to be able to implement a particular intervention. And I couldn't find any evidence for that. No, they didn't talk to us at the top, They don't talk to us from the bottom. But within the, executives, of course we did talk about it. We did raise questions as to what is this? How did it get to be what it is? Yeah, you're always reminded in government that you are a civil servant. And I made an interview. I think I was in Cape Town on a radio station, and I made an interview on this virodin issue. I said, well, we need to find out whether this thing is scientific or not, We need to hear from the Medicines Control Council. So even at that particular time, I did go public, on my position with regard to this issue. Yeah. I mean, even with Sarafina, I mean, clearly, I mean, if you look at the issues related to whether I was involved in the initiation of Sarafina, I wasn't. You know, I came into the department, walked into the department when Sarafina was already, you know, an issue, you know. But as a director general of a department, you try by all means to say what it is that you can correct. Yeah, I mean, mistakes happen all the time in government. I mean, you know, there's always, I always say there's always a 3% human error in anything you do. So it's possible that, you know, errors were made, and it was important that those errors actually be corrected. No, well, we disagreed in terms of how this Sarafina thing, you know, ought to be handled. And yeah, we disagreed, and as a result of our disagreement, we then decided that it is better for us to actually part ways. I do recall the former Minister of Foreign Affairs, which is Mr. Alfred Nzo, trying to mediate to see whether they can be able to find middle ground, you know, on this matter. It didn't work. He called me to the office and had a discussion, and it didn't work. And Sipho Pichana also tried, you know, to mediate between the minister and myself, you know, on this matter, and we didn't agree. Yeah, so we parted. But that didn't spoil our relationship after I got out of government. 3 months later, I actually met her when she came in. I was working for WHO. I met her in Zimbabwe. We were in an elevator together. And we were just back to, you know, people that knew each other. And we treated this issue of Sarafina as something that happened in government, but that did not affect our relationship, you know, as... yeah, it's just a professional disagreement, but not a personal disagreement.
Okay, so it wasn't sort of personally acrimonious for you?
No. At the end, she and I were not acrimonious toward one another. Yeah.
How did you feel leaving the Department of Health? I mean, having been in exile, having returned to South Africa, having obviously committed yourself to the transformation. What did it feel like for you to leave?
Well, it felt like I was going back in exile. Just leaving South Africa and going to work outside felt like I was in exile, and I was glad to be back, you know, to South Africa later. But it's something I had to do to, yeah, it had to be done. I had to take a job outside.
Right. What compelled you to take a job outside?
It was a bit difficult professionally at the time, given the parting of ways with my minister. So cooling of the tempers a little would help, you know, possibly on both sides, you know, just to professionally to say, let's move on. When I came back, she was no longer Minister of Health. We now had Mantu Chabalala as Minister of Health. I started sending messages to the Minister of Health and say, what's going on about this issue of HIV? Why are we taking positions that are not evidence-based? So I started raising those questions, you know, with her to say, I don't understand.
The new minister now?
The new minister now.
Okay.
Yeah, the new minister, Mantu Chabalala. Yeah, Dr. Mantu Chabalala. And I started asking those questions and said, what's going on? And she started referring me to some books, you know, on HIV, to say, you must read these books. And these books were written by dissidents. And I said to her, come on, these are dissidents. You know, they don't believe that HIV causes AIDS, you know. So came back, and I also asked the Director General who was in office then. I said to them, what's going on with the President and the opposition party arguing in Parliament about science? What's going on? Why are we in this situation, in this space? This is not the space of politicians to argue about science in Parliament. Science is something that should be argued by scientists outside. And of course, there's nothing he could have done. I mean, the parliamentary privilege of saying what it is they wanted to say, there's nothing he could have done. And he's just said, you know, we do what we can to try to advise, but at the end of the day, the politicians take their own positions. So we then said we've got to do some research on this issue, because they say HIV doesn't cause AIDS, and they also say that there isn't a big problem of HIV in the country. So we said, well, how big is it? Because the only information we have is on antenatal data. So we went to Mr. Mandela and we asked him, his office, for money to do a study, the first study on the Mandela HSRC study on HIV/AIDS. And we got money that allowed us to do the population-based survey. So we tested. We went out and interviewed more than 10,000 people, and about 8,000 of them, you know, responded in terms of testing. And we tested them, and we came back and we said, here's the prevalence of HIV in South Africa. This is what it is. It's big.
At that point it was?
About 11, close to 11%. Yeah, close to 11 point, I think it was 11.4%. And we said, when we launched it, we invited Mr. Mandela to come and launch the report. He was so pleased that his foundation was able, you know, to do this kind of research and be able to provide evidence that showed that HIV/AIDS is a problem in South Africa. And I was so glad, because that research also showed that those people who did not believe that HIV causes AIDS had a higher prevalence of HIV than those who believe that HIV causes AIDS, showing that the position taken by the politicians was actually harming efforts of prevention. Think about the situation of Singapore, where the president of the country says, you know, we shouldn't grow the population that quickly. And everyone has 2 kids. And then for a long time it's 2 kids. And then they begin to realize the fact that the population is not growing in terms of employment. They have to import people and all that. And then the president says, I think we should have more kids. You should have more kids in order that we can grow the population. Everybody goes to bed, and the next thing you know, you've got 3 kids, you know, in the family. So I think human beings, by their very nature, they look up to leaders for direction. So leadership is very critical, absolutely critical. Once the results came out, they were all over the world. They could not be ignored. The denialists started attacking us. Anthony Brink started writing letters about me, personally, and wrote this letter and copied it to the entire cabinet, questioning my methodology, questioning my statements about why my findings show that black people have got the highest HIV compared to whites. Questioning why I said KwaZulu-Natal had a very high HIV prevalence, including, Mpumalanga, why, he started questioning my geographical analysis of HIV and saying that I'm influenced by white people, that in other words saying that I'm not a good scientist, I'm influenced by white people, believe it or not, and demanding that I must respond, to that publicly. Even it's in the internet, you can find it in the internet if you want to, and saying I must really come clean, on this, that I'm not a good scientist, and all of that. And some cabinet member came to me and said, you must respond to this thing, at least inform cabinet in terms of what your position is. And I said, I'm not going to do that. They say, why? I said, I don't answer dissidents. Dissidents are not interested in evidence. So if I answer them, I'm going to spend most of my time doing nothing but answering them instead of understanding this epidemic and unpacking it for the nation. Yes, when I came back, the Minister of Health asked me I should join this, panel that had been set up between the dissidents and the scientists, and I just said no. Why should I even give them prominence? My view is that there's no need to give them prominence.
Did you ever meet any of the dissidents?
The only dissidents I met was when I was in WHO. Yes, and I met those dissidents. They came in to try to meet with the Director General of WHO. Because I was in charge of HIV/AIDS globally, she then said to me I should sit down and meet with them. And I sat down and met with them and listened to the arguments that they were making, and I found out this was nothing. There's nothing there. And I said, there's no need to continue meeting these people. There's nothing.
But your minister at the time had sent you some books you mentioned.
Yeah, they told me about the book I should read.
Any of those books?
No. If you understand science, you know where you should put your energy. Put your energy in those things that are going to advance the knowledge so that that knowledge can be applied, to address the problem that you have. I don't know. I was not in the country. I was outside of the country. I also tried to analyze it just like everyone else was trying to analyze it.
What did you speculate though? You must have speculated.
We published an article on the, I think it was there's a book on the new state of the nation, where we tried to speculate that possibly he kind of thought that this issue was affecting black people. So the assumption is that black people are promiscuous. And if anyone came to give him an alternative explanation, he would grab at that alternative explanation. I just thought that it was very much related to his own thinking that blacks are being seen as somewhat inferior in terms of their behavior, that their behavior is unacceptable, and he just couldn't accept that. He wanted an alternate explanation, and so when these people realized that he was vulnerable from his thinking, they actually found a way to weave themselves in his life. Unfortunately, he actually bought into it. I may be wrong. I think what worried me most is the fact that he had the audacity to write to the entire cabinet about someone so insignificant as myself. One individual, a letter directed to Olive Shisana, and it was about more than 15 pages, of the letter going out there to cabinet and saying that she's not a good scientist, she's been led by white, people. I sort of found it to be, I couldn't say amusing. It's not amusing. In a sense, it was a shock for me. I mean, I was like, how can someone dedicate their time to sit down and write a critique of my work and focus on those issues that relate to race, and make it look like I was going all out to hate the black people, the daughter of Africa, I mean, those were the words. Not really, because I didn't know him. I don't know him. I've never met him.
So you didn't take it that personally? You thought it was a bit stupid?
I mean, he couldn't have betrayed me because I never know whether it was this person who was any loyal to anything related to what I believed in. I just said, why does this person have the courage to be able to write something like that, which will become history? and even put it in the net where everybody else is going to see it. Because his argument was the fact that HIV doesn't cause AIDS. That was the primary argument that he was making. He was a lawyer, not even a scientist. So that bothered me to say that, I'm a public health person. I've trained at Johns Hopkins University. My training it's a doctor of science in public health. And here's a lawyer writing to me, telling me that the science is not right and that I don't understand science. He was even questioning the methods that we're using to test people for HIV. It was already influential. The fact that there was a panel that invited people even from the Centers for Disease Control to actually sit on the panel, and scientists from South Africa, top-level scientists from South Africa, having to sit with these dissidents to try to unpack as to whether does HIV cause AIDS, when actually there was scientific evidence which was pretty much irrefutable. To me, that it meant that the human capital was diverted, from focusing on important issues related to advancing knowledge on HIV/AIDS to actually trying to convince a group of people that were not so important, but suddenly became important because of the fact that the president has set up the panel, because it was a presidential panel. Yeah. And I thought it actually caused a bit more harm in the sense, not a bit more harm, a lot of harm, in the sense that instead of energizing people to move together, it divided the population.
Well, it kind of created a strange polemic, didn't it, between science and politics?
Yes, then you had a very untidy relationship between the scientists and government. What I did, which was very exciting actually, I was asked by the current president, who was a deputy president at the time, to set up a program to train staff, on HIV/AIDS management in the world of work. So I set up a program between Medunsa and Stellenbosch. And that program, he actually personally launched, the program. And at the time, he was a deputy president, and he was very, very supportive, I must say. He actually brought in about 200 people at the launch, top people from the public and private sector, and acknowledged, the work that we're doing, and launched the program between Stellenbosch and Medunsa with the two vice chancellors, there, as well as the people that were doing the program there, which was very good. Following that, he convened a meeting of the top leaders in the mining industry together with us to sit down and see how they can make a contribution to this kind of program. So he was very committed, to the program. Yeah, so that's what brought me back into focusing on HIV/AIDS when I came back into the country, because I was a professor at the Medical University of Southern Africa, Medunsa, and I was teaching health systems, program, setting up a health systems program, but I also taught HIV/AIDS, and that's when he asked me to do that job, which was very good. Yeah, I like that program because, why? Because today it has gone almost global. More than 50 United Nations staff members studied in that particular program. It was difficult, but what I liked was the fact that at that very time, the deputy president of the country was moving in a different direction from the president. Yeah, I think President Zuma was taking things in a very different direction insofar as HIV is concerned. I mean, this was an issue that he was concerned about, that, it's killing people. And at the same time, what was also positive was the fact that Mr. Mandela himself was personally involved. I recall being flown from Cape Town to Mr. Mandela's, home to brief him on some of the areas on HIV so he could understand on prevention of mother-to-child transmission program, what it actually meant, on the issues of ARVs, and so forth. There were about 3 of us actually that were brought into to that meeting. But the point I'm just trying to say is that there was a political momentum insofar as HIV is concerned, not only from the Deputy President Zuma at the time, but also Mr. Mandela, himself, former president. So we felt that even though we were not getting the support that we needed from the Minister of Health as well as the President, on HIV, we actually had support, from the other part of government and the former president. So it was comforting to say, look, at least we've got some support, so let's move on. All the entire people at the Human Science Research Council, I had a team that was working on this thing, and we just said, we've got to continue to do the research that is actually required, despite the fact that this is not even funded by the state. We had to get money outside of South Africa. We had to get money from South Africa with the president in 2002. But by 2005, we had to get money, in fact, from 2005 was CDC that actually funded us to do that research. We disagreed, and my disagreement with her was the fact that she didn't seem to see this as an emergency. I kept saying, this is an emergency. People are dying. And she didn't seem to see that as an emergency. So we disagreed on that basis. We disagreed. I mean, I liked her a lot, by the way, before, she took on this kind of positions, because she was a very progressive person. We worked with her very well when she was with the progressive primary health care. And, she was very positive and all that. And I couldn't understand. I kept saying, what happened? Why have you changed from the position that you used to hold? Because you used to be the person who really drove HIV/AIDS work under the progressive primary health care. What has happened once you took the position? I couldn't understand. No, I just asked questions. Is it because now you are a Minister of Health working with the President and that's why you are taking these positions? I don't know. I asked those questions, yeah. But I was so surprised because she was such a good person, I must tell you. Why all of a sudden she just changed direction altogether was, a bit of a surprise. What I'd like to say to them is that should we have taken major steps starting with the apartheid government on HIV/AIDS in 1990, 1991. Should we have done that, I think we could have cut this epidemic, by 3/4. This epidemic would not be where it is. So what I want to say is that for future generations, it's very important that when they see a new disease starting, to mount major intervention programs to stop it on its track. Leaving it really create massive problems that are very difficult to deal with, because HIV will be with us for the next 40, 50 years.